All right, we'll go ahead and get started. Well, thank you everybody for joining us. This is our Bro-tox virtual event where we elevate his self-care routine. A little bit about today is we are going to have a giveaway for a lucky attendee. You're going to meet the Revive team as well as learn all about neurotoxins. We're actually going to have a live bro doing a Bro-tox. We have questions and answers at the end, but please feel free as you have your questions that go ahead and put them in the chat and we'll get to them as we can. And then we're going to have a special offer specifically for this event. So stay tuned till the end. So this beautiful young lady next to me is Sydney. Sydney, can you introduce yourself?
Hi, everyone. My name's Sydney. I am a nurse here at Mission Valley Revive. I also work at East Lake a couple times a month, every other Friday. I've been a nurse for 10 years. I've been in aesthetics for almost 8. I just finished my nurse practitioner program. So I'll be testing next week. Wish me luck. And I specialize in everything we do here at Mission Valley. It's hard to pick just one treatment because the way I approach my patients is, skin forward, full face. We want to treat everything. We will prioritize what is most important to you, and then we'll utilize all the different modalities to help get a well-rounded, full face result to help you feel more confident.
Wonderful. And welcome back, Sydney. We missed you. Sydney was on maternity leave for a while and she just came back when?
Yes. I came back in April.
All right. Well, we missed you.
Happy to be back.
And hi, everyone. That's me. I'm Julie Norton, our VP of Sales. I've been in aesthetics for over 14 plus years. And yes, I know it ages me quite a bit, but I started in the beauty industry as a licensed cosmetologist. I will still, cut friends' hair and do my own hair. And I am definitely an aesthetic expert in the field. I've done pretty much every single treatment at least once. And it's hard to kind of pick, as Sydney said, it's really hard to pick a single treatment because they really work well together. But come see us here at Revive and we'll do that full facial assessment for you. So this is a little bit about Revive Med Spa. We've actually been around for over 20 years. So we are standing in Mission Valley today, and this location has been around for 20 years. We have 8 locations across California, but the picture to your right over here is our East Lake location, which Sydney said she works out of every other Friday. It is beautiful. It's our newest of our San Diego locations. It's huge. It is absolutely gorgeous. So go ahead and visit us there. But we are the #1 providers for Botox, all HA fillers. We also do a lot of cool sculpting. We have our master sculptor in Carmel Valley, and we're #1 in Morpheus 8 in all of California. We have 5 convenient locations here in Southern California and 3 in our Northern California. All right, a little bit about our medical team. So Dr. Vishal Verma, he's been here since the beginning, so over 20 plus years when he opened up Revive Med Spa. Dr. Megan Naud, and our medical team is dedicated to identifying suitable surgical and non-surgical options. We're always looking into cutting edge technology as well as new treatments, and who knows, maybe we'll have another one coming here soon. We're consistently providing advanced training opportunities for our medical professionals. So all of our medical providers are highly trained. They continue to keep doing training here at Revive. So we have incredible providers. All right, what we're here for. So for those that don't know what neurotoxin is or has never done any type of toxin, Sydney, can you go over a little bit of what that is?
So neurotoxins are the product that we use to relax the muscles to prevent fine lines and wrinkles. Most common household name is going to be BOTOX. The ones we carry at Revive are Dysport and DAXXIFY. When we do the injections, you kind of have to wait a few days, give it a full 2 weeks for it to fully kick in. And then you'll notice it's just harder to make those facial expressions. That lasts about 3 to 4 months. And the expectation is that you just have smoother fine lines and wrinkles. But the biggest thing is that it's preventing wrinkles from getting worse.
Love it. It's a great first step for anyone looking to get aesthetics done.
Oh yeah, right? To dip your toe into everything that we have.
Yeah, it was the first treatment I ever did and loved it. All right, so how do they work?
So I kind of mentioned it earlier. It's when the toxin is injected, it talks to your muscle. It tells your muscle to stop sending out signals for movement. And again, takes 2 weeks to kick in, but it's really just treating the muscle. So it's not treating the skin. It's not going throughout your entire body. It's just muscles only. And it's just preventing the movement. I like to compare it to like a piece of paper. When you fold a piece of paper and put your finger across the fold, it's going to create that line. And when you open it, it's hard to get rid of the line of the fold. Botox is preventing that paper from folding in the first place.
Love it. And this picture is such a great before and after too, because you can see him like lifting his eyebrow. And then I would assume in that next picture, is he trying to lift his eyebrows?
Yeah. In both pictures, he's trying to lift his brows. The second one is obviously just once the neurotoxin has kicked in.
All right, Bro-tox. So what that is Botox for men, or tox for men. Can you tell us a little bit about men getting aesthetic treatments?
It's definitely getting more popular among men. Men sometimes take a little bit longer to realize that they are aging, and that they do actually want to do something about it. But it's definitely becoming more acceptable, especially here in Southern California. And the taboo around it is fading because it's really so simple. Like the goal of it is just to keep you looking the same, not changing the way you look. And people are realizing that. And guys are getting more comfortable with it, and women are wanting their husbands or their partners to look the same age as them.
And I feel like men, a lot of times too, they age like fine wine. Like a lot of men start getting better looking as they get older. Women probably feel a little bit more like organic fruit.
Yeah, well, men are allowed to, we like the rough around the edges type of thing. So we don't want them to be completely frozen, completely like wrinkle free. But you know, there's a line, and everybody has different or opinions on how they want to be, and we can address that on a personal level.
You can still be manly and get your Botox.
Oh, absolutely.
Still look manly.
Yes, very manly.
Botox. And Rick, we are going to go through that in just a moment. All right, this is probably the most common name, Botox. So what is it doing? What's Botox?
Yeah, so Botox is like, you know, Coke. It is the most common. It is not Coca-Cola. It is the most common neurotoxin. It's actually been around the longest. It's been around for like 30 years. There is tons of research on Botox, not just for aesthetics purposes, but for treatments in the hospital. Another really well-known one is for migraine treatments. It is kind of like the gold standard, and yeah, it's just the most well-known. It's kind of like Band-Aid. We call them Band-Aids, but that's really just a brand. It's just adhesive bandages.
And I know, like, I even have friends that have gotten Botox for their like muscle spasms and like other things too.
Yeah,
so
they use them for like stroke patients in the hospital.
Yeah.
But Botox, the result of it, it kicks in like it takes a little bit longer to kick in, but people really like it if they want that more frozen effect.
All right, Dysport.
So whereas to Botox is like Coca-Cola, Dysport is like Pepsi. They are the two big major names in the industry. Dysport is kind of like the European cousin to American Botox. But it allows for muscle, like a little bit more of like a softer feel. It's still freezing the muscle, but you might have a little bit more of like dynamic movement. It kicks in a little bit faster. You'll see results within the first 2 to 3 days. And for all the neurotoxins that we have, the expectation is to last about 3 to 4 months.
And DAXXIFY, that's definitely a newer one. Tell us a little bit about DAXXIFY.
Yeah, DAXXIFY is pretty new to the industry. Definitely the newest product that we have at Revive. It is, again, it feels a little bit more natural, kind of like how Dysport is, but it has a peptide in it, which gives a little bit of a skin glow. People really like that. And it has like 24-hour you start to see results within 24 hours. So people really like that too.
Yeah, that's fast. Todd had a question too about, can you comment on how Botox might weaken your facial muscles over time, particularly in older men?
So, I mean, there's studies on that, how in the forehead it can weaken the muscle, but the effect that it would have on the way that it looks is minuscule. Yeah, like it doesn't have negative effects. And realistically, you could always take a break or go a little bit longer in between your appointments to regain that muscle. Mm-hmm. It's just like stopping working out. You know, I always say to my patients, like, if they've never gotten Botox before, your muscles are like like someone who works out a lot, you know, a weightlifter, and we're telling it not to go to the gym anymore. Your muscles aren't going to shrink the next day. They're going to shrink over time. Like you don't go to the, you know, you can't go to the gym, but then the Botox starts to wear off or the neurotoxin starts to wear off and your muscles can move again. And so then you're regaining strength in between. It's not just like you do Botox, then you'll never be able to move the muscle again. As it's wearing off, your muscle regains strength. Like you can even see it, like I can still move my forehead. I don't know. I can still move my forehead. I'm not losing all strength. It's just inhibiting movement enough to prevent those lines from creasing. But you can still have some movement.
Yeah. Thanks, Todd. So treatable areas, I know we just talked a lot about the forehead, but Botox we could treat in a lot of different places.
Yeah. So the most common areas is going to be the glabella, which is between the brows, the forehead when you raise your brows, and then around the eyes, which we call the crow's feet. Other upper face is around the nose. You can do the bunnies. You can lift the tip of the nose, prevent nostril flaring. If you have a gummy smile or your lip rolls in when you smile, you could do Botox right there on the upper lip. A really popular one is the DAOs, preventing the pull down at the corners of the mouth, and it kind of gives you a little bit of an upturn at the corners of your mouth. You can do chin, you can do your masseters if you're grinding, you could do a Nefertiti neck lift, which helps the muscle here sit tighter to give you like a more snatched jawline, and you can do the platysma bands to help prevent you know, just the muscle pulling away here. Mm-hmm. if especially if you notice it when you're talking.
Yeah, as I've gotten older, I've noticed the platysmal bands a lot, especially when I'm like working out.
Yeah, like if you do a bit like E, and if you see like those bands sticking out, we can hit those. Mm-hmm. And then the last one we have here is you can treat your underarms to, you know, help reduce sweating. So that's a really fun one.
Yeah, especially now in the summer.
Oh yeah.
Yeah. All right, some Bro-tox in the forehead. Love this. Looks great.
Yeah, so here, I mean, like the photo we saw before, he's trying to raise his brows in both photos. And the second one, it still looks very natural. You just see that it doesn't scrunch up as much with the neurotoxin kicked in.
I'm also very jealous of his curls.
And his eyes. All right, and then in this one, you can see these are a very common one. People call it the 11s. We just don't want those lines to get deeply etched in the skin. A lot of people say that they feel like they look angry, but they're not. So that's a big a big reason why people want to get Botox right here, because it kind of like lifts this area a little bit and it prevents that like angry look.
All right, crow's feet area. This is common, very sensitive.
Oh yeah, I mean, crows are my favorite. It's where I personally feel like I need it the most, but it's just preventing those lines from getting too deep. You can still smile. It just relaxes the muscle, so it opens up a little bit, so it's not creasing as much. If you want, you can get a little bit of a brow lift. That might be more of like a female tailored approach. For men, we might want to do more lateral, so they're not getting so much of the like a brow lift. But yeah, it's a big one. You still look happy, you still like you're having a good time, you just have less wrinkles when you do it.
Great. All right, so we actually have a live bro for our Bro-tox event today. So Sydney is going to be performing a consultation, full facial-ish assessment, and treatment.
All right, perfect.
All right, everybody, this is our model, Travis. Everybody say hi to Travis. All right, perfect, Sydney.
Okay, let's see. Maybe that mirror right over there, please. Thank you. So I always like to hand my patients the mirror. When you're looking in the mirror, what bothers you the most, you know, when you're making facial expressions or
Particularly like these lines. You get hair.
crow's feet? Yeah. Okay, so let's go ahead. I'm gonna have you put your brows together as much as you can go. You don't really make a crazy face like that, but see those two lines right there? Those are the main ones we don't want to kick in. And then when Botox goes here or neurotoxins go here, it's just gonna lift slightly, nothing crazy, it's just gonna lift. We need to treat this area if forehead bothers you because this helps to prevent you from feeling heavy. But then go ahead, raise your brows. Okay, and then we have these lines here. You can see that they're kind of starting to set in. Right now is the perfect time for you to start tox because we don't want those to get any deeper. So go ahead, raise your brows one more time. Yeah, so these are hardly even set in the first place. Really what's going to happen is it's just going to neutralize this muscle so that it doesn't scrunch up as much. You're a little bit of a difficult patient because your lines go a little bit. That's okay. I'm highly trained. We know how to deal with this. Your lines go a little bit lower above the brow. So that's something that just realistically you might have some movement or lines left over right there, just really low in front of here because of what I don't want to happen is for you to get heavy. So it's kind of the caveat. But with that, we can treat the crows. The crows will open this just a tiny bit to prevent you from feeling heavy. No, you'll look better. Yeah, not better. You're just gonna look how you do. Yeah, how you do at rest, you know, and then we're just trying to like maintain this 30-something-year-old pocket for you. You know, Botox is not about looking younger, it's about maintaining the way you look now. And you know, it can soften lines that have already set in. So you're not like, you know, it's even though it is preventive, the best time to start is now. So don't worry if you have lines already set in, we can go ahead and still treat. And then we have other great things like microneedling or lasers that you can incorporate into your treatment plan if you want to start to erase those lines from the outside, because Botox works from the inside, and then everything else we do is, a lot of other treatments we do will help erase from the outside. With that said, I'm going to go on my sunscreen soapbox here. Wear sunscreen. If you don't wear sunscreen, start wearing sunscreen. Sunscreen, if telling people to wear sunscreen is my love language. It's going to prevent collagen, the breakdown of collagen. It's going to prevent premature aging. And the most important thing is that it's going to prevent skin cancer. So if you don't already do it, wear it. And I swear I've never met a man who didn't like tinted sunscreen. So that's just a little, tip there. No, they love tinted sunscreen. Yeah, they did I say that correctly? Men love tinted sunscreen. Okay, so we are gonna go ahead and you can stay there. I'm just gonna grab my stuff. Okay, I'm gonna wipe you off, mark you up. I'm gonna hand you, here's a little stress ball. Okay. And here's your little ice cube. Oh, that's it. Okay, I'm just gonna start wiping your face. You need it. Are you comfortable resting your head all the way back?
Okay.
Yeah. Relax. There we go. Okay, go ahead and turn a little toward me. And I'm gonna have you put your brows. You might need to scoot down a little bit, and then you'll fit perfectly there. Is that better?
Yes.
All right. Brows together as much as you can go. Okay, I'm just gonna mark. And then we'll go here. Okay, brows up as high as you can go. Try again. All right, and then big smile, kind of squint the eyes. And then turn toward me, smile, squint. Okay. And then if you want to start holding the ice right between the brows, that's where I'm going to inject first. I like to use the ice because it helps to constrict the blood vessels and it gives a little bit of a numbing effect. And this is Travis's first time, so we're approaching a little bit conservative. We're gonna do conservative dose at first, but realistically, we need to dose based on the strength of the muscle. Men naturally have stronger muscles, so you do have to do the appropriate amount to get the 3 to 4 months longevity. And then also sometimes when you get those weird like Spock outcomes, you're not going to get that. It is due to the fact that you needed more Botox in the first place. And then also like I kind of said before, you need to do the right amount to get the longevity. So everybody talks about like baby Botox, things like that. That's like putting $20 in your gas tank and for a cross the country road trip. We want to get across the country, or at least as far as we can. So we fill our gas to full. Okay, go ahead, rest your head back and turn toward me. And you go ahead and move the eyes. Turn a little bit more, brows together, and relax. Just gonna get a little poke. How's that?
Fine.
Not bad, right?
Nope.
Brows together and together. All right, those are the spicy ones.
Yeah, I don't understand.
But it's over quick. Head raise your brows high and relax. Raise your brows high. You guys can see the little bumps on the camera. That's normal. It goes away within like 15 minutes. I'm gonna have you hold the ice right over here.
Yeah, it's gonna be-
Mm-hmm. And then when you're ready, you can rest your head back and move your ice to the other side.
How long should I do this one?
Whenever you're ready. All right. Yeah, squeeze that spiky ball. Okay, big smile and relax. Smile and relax. Okay. Okay, so now, yeah, we're gonna have to make that a little bit. Smile and relax. Smile. All right. You are all done. Torture's over. I'm
Okay.
gonna have you eyes just right there.
Bro-tox. There we go.
Okay, so now is the hard part because it takes, you know, a week or two to fully kick in. And to me, that waiting is much worse than getting poked. But yeah, it'll kick in. He'll start to see results in the next few days, final results in a week or two. And then at that 2-week mark, we always allow our patients to come back in and we can reassess. I might see something that I want to kind of tweak a little bit, or it might be a matter of we need to increase the dose. So we kind of, just like any medication, you need to find the right dosage for you. And we figured that out through, you know, consistent appointments.
Right, perfect. Well, thank you everybody for joining us. I think one of the biggest things and takeaways here is a lot of our new patients are not doing post-op appointments, and we really want to make sure that you're coming in and that you're happy with your treatments. And so it's important at that 2 weeks to come on in, whether you think you need it or you don't need it. It's important to come in so that your provider can take a look. Would you say most of your new patients come in?
Too, especially if it's their like very first time, or if they're trying a new neurotoxin, like a new brand. I always say come in at the 2-week mark, schedule the appointment. It's a quick 15-minute appointment. You can always cancel it if you don't need it. But if it's there, it's kind of, you'll get the reminder, and then you can, yeah, again, always cancel. Same with pre-booking for your next appointment in 3 to 4 months. We do the save now, save later, which helps you get savings. So when you pre-book, it kind of holds you accountable to be consistent, because that's when you're going to get the best results.
Perfect. Well, thank you, Travis, for being our wonderful model.
Thanks, Beth.
And these are our social media. We have Instagram, TikTok, Yelp, and YouTube. On our YouTube channel, you'll see all of our other virtual events that we've done as well. So if you have questions about any of our other services, you can find some more information there. Thank you, everybody, for joining. Let me just make sure that we don't have any other questions in the chat. All right. How many units? We will post that in when we do the posting for our event, we'll put in exactly how many units was used for him.
Yeah, but a very average amount of units is going to be about like 50 to 60. You know, it really just depends on your muscle movement. So it depends what the provider sees at your appointment. But a good number to kind of have in your head is like 50 to 60 units.
And would you say men typically get more than?
Yeah, men can absolutely need more. I mentioned it before. Men just have stronger muscles to start with. So, you know, you guys are so strong, and you need more tox to weaken those muscles.
Yeah, I actually see a lot of men patients on the Zoom today too. So thank you, Chris and Jacob, Rick, Todd, William, for joining us. If you have any other questions, please don't be shy. You can also comment on social media and get in touch with us. Otherwise, you can come in for a complimentary consultation. And again, Sydney's here. Welcome back to our Mission Valley location, and then every other Friday in our East Lake location. Thank you, everybody.
Bye.